by the federal government.
The State Medical Association says the amount of money it gets from Washington to care for the disabled and senior citizens is about to be drastically cut. And as Dave Jordan tells us, that could impact the care Oklahomans receive. Dave?
Well, Amy, this all goes back to the funding formula the federal government uses to determine how doctors are reimbursed for Medicaid patients. Apparently, this formula, which was put in place about 10 years ago, started at a deficit, and now it's likely doctors will take an even bigger hit.
That financial hit could affect the medical care of hundreds of thousands of Oklahomans who receive Medicare benefits. Call it a perfect storm of rising costs and lower reimbursement rates.
The cost has gone up by 25%, but our reimbursement rate has remained the same, which means that we are already at a 25% disadvantage.
Right now, there are about 600,000 Oklahomans receiving Medicare benefits. That funding could be cut by as much as 21%. Now, that could also affect the state's 200,000 Medicaid patients. Even though Medicaid is a state program, reimbursement rates are tied to Medicare, and that program could be cut by about 19%.
That is going to restrict the access to health care for majority of Medicare, Medicaid, and TRICARE patients. The TRICARE patients are the military and their family.
Now, doctors across the country are asking those covered by Medicare to sign an online petition, pretty much asking Congress to fix the funding formula.
We're asking Congress, this is ridiculous. Let's get this fixed so that we can continue to see really our most vulnerable patient population in Oklahoma.
Which for Oklahoma could soon be a reality.
Many physicians have already expressed how they can opt out of Medicare, and that is going to be a bad news for our patients.
Now, you're probably wondering where the health care reform law fits into all of this. Well, quite frankly, it doesn't. That's because the funding fix for this program was in the House version of the health care bill, but it was the Senate version that was passed, and the funding was not included, Amy, in that version.
I see. All right, Dave. And you can find the petition on our website at newsnight.com.